Good evening everybody. Myself Dr. Avinandan Banerjee, consultant nephrologist and transplant physician at the CK Bill Hospitals, Kolkata. Today we are going to discuss about one of the most common presentations we see in the OPD, that is edema. Now what does edema mean? Edema means collection of excess fluid at interstitial spaces or places where it's not supposed to be. It can occur in face, it can occur in abdomen, it can occur at feet. Commonly what we see is the edema occurring in the legs, that is called the pedal edema, or it's called ankle edema or pedal edema. And generally edema, it can be of two types. It can be pitting or non-pitting. Pitting means what can be compressed with fingers and it goes down. Another one is which cannot be compressed. Commonly this edema is caused by a multiple disease, drugs and some physiologic conditions. The common physiologic conditions which may cause this edema is pregnancy, where we can see development of physiologic swelling in the legs apart from having any form of disease. But there are some disease which may affect multiple organs that may give rise to edema, like any disease which may affect your heart, where the pumping action of the heart goes down. Generally it may cause edema in the legs. It can be any disease of the kidney as well, like chronic kidney disease, nephrotic syndrome, which may cause edema. There can be liver disease as well. The cirrhosis of liver can give rise to edema. There are some hormonal deficiency like the hypothyroid status or the myxedema, which can give rise to edema as well. Apart from this, there can be local cause like cellulitis, chronic venous insufficiency or lymphedema, which can cause this edema in the feet. Now what is this difference? The pitting edema, non-pitting edema, what can be compressed, and other thing that cannot be compressed. The commonly non-pitting edema is generally seen in case of hypothyroid or myxedema, and other disease which I have said generally causes pitting edema, which can be compressed with a finger around your ankle. It has some grading, like the severity wise it has grading from 1 to 4. With the amount of depth the fingers can go, it from varies from stage 1 to stage 4. What are the common symptoms? The local area becomes swollen, it becomes shiny, it may form blebs, and in case of severe edema, that blebs can burst and fluid may exude out. So what are the common treatment what we do for edema? Generally for those which are physiologic in nature or for local diseases, generally what we do is we advise to elevate the limb above your lying down level, where the fluid will reabsorb automatically. Apart from this, we can advise for local stockings or pressure garments which may reduce the edema. We can advise restriction of fluid for disease and as well as of salt. There can be use of some diuretics, like those which may cause increase in urine and the fluid may be drained off from the body. And the basic treatment will be the treatment of the basic disease which may cause this edema. So whenever a edema appears in your body, it always is not alarming, but you should be meeting your doctor to know the cause for the edema and treat accordingly. Thank you.